biggest challenges we're facing in medical education in Illinois probably deal with the retention of physicians we train to stay in Illinois. There are many problems that exist with respect to liability and the ability to keep Illinois physicians who we train. Illinois is a net exporter of physicians, but one of the things I think that really is going to be a challenge for us is to figure out how to retain more and more of those young physicians in a climate in which liability is still a problem. I think one of the issues that I'm always interested in whatever setting I go, is how we can use medicine to help to eliminate health disparities. One of the initial foci that I had when I came into medicine was the treatment of sickle cell disease, the disease that predominantly affects underrepresented minority communities. And from that, I learned more about health disparities and eventually ended up teaching a course at the University of Chicago that was related to health disparities, becoming involved in the AMA's advisory group on minority physicians. Through that, I became also involved in the Commission to End Health Disparities. And so my work in organized medicine as well as in medical education have come together to help to try to understand more about how we can eliminate health disparities. The single biggest challenge for physicians in Illinois, I believe, is the transition to the Affordable Care Act and the challenges it presents for both physicians and patients in dealing with many of the nuances of the law. People have fear. Their question about whether physicians will be able to function the same way with their patients and have the same patient-physician interaction is at the core of what really is drawn into question with the Affordable Care Act. Our hope is that we will both work together as physicians and patients along with the government to try to figure out the best way of transitioning into this so that we can provide the excellent care we always have.